Well, let's stay with this story. We're joined now by Doctors Without Borders, the group weighing on the continued operations of Dudulla movement, calling for immediate intervention by government. The organization says the ongoing stoppages are distressing and unacceptable. Let's speak to the representative now, Claire Waterhouse from Doctors Without Borders. Claire, good evening to you. Thank you very much for your time. Your team says it's been going around, at least in 2 provinces, documenting the experiences of the undocumented migrants. Just talk to us briefly about what you have gathered so far. What is the experience on the ground?
Thank you so much for having us. And if I may, before we continue, I would just like to clear up one misconception, which is that this is only impacting undocumented migrants. It is not. This is impacting even migrants who have valid visas, valid permits, valid IDs to show they are still being turned away from these health facilities. And some South Africans are as well. We have seen scenarios where a South African does not look or sound South African enough and also being turned away. We've heard stories of young people who've forgotten their IDs or don't have their IDs yet, who have been turned away from clinics. So I think what the Section 27 of the Constitution guarantees the right of access to health to all who live in South Africa. So documentation status should not matter. But in this case, whenever we are saying only undocumented migrants, it's not actually true. But if I can take you to what we discovered when we did our assessment the other day, we've been getting these calls, we've been getting these reports with increasing frequency, a lot of very distressed patients. And when we went and took a look around clinics, we found that more than half of the 15 clinics that we were able to visit in person were physically blocked by members of anti-migrant groups. Then when we called up to 50 patients, we found that there were more than 24 facilities just in that group of 54 who were turning away patients. And we are particularly concerned about patients who really need to access healthcare, such as pregnant women, babies, and people living with chronic conditions like HIV. As we know, it is extremely dangerous for all of us, as South Africans or non-South Africans, if ARVs are stopped for people with HIV. That can be a real public health issue. So all of these are very concerning to us.
Yeah. Of even greater concern, Claire, is what you suggest is the involvement also of security staff and healthcare workers who are working in collusion with members of Operation Dudula. The burden of proof, people are going to say, prove it. Where do you have this information, or where is the evidence that members of staff within these clinics are colluding with Operation Dudula?
Absolutely. Thanks for raising that. So we were getting a lot of reports of that as well, but we do not speak about things unless we have witnessed them with our own eyes, which is why we sent teams to clinics, because we are a completely neutral and impartial organization. We do not receive funding from any government or anything like that, particularly so that we can adhere to our strongest principle, which is to witness what is going on in different health systems and speak out about that. So, I mean, it is up to people whether they take us at our word or not, but I can assure you that at least 2 clinics, we saw situations with our own eyes that showed us that security was working with Dudulla. In fact, doing the job for Dudulla in some cases. And in another facility, we saw healthcare workers who were actively collaborating and supporting with the group that was stationed outside. So we know that this is happening. I'm quite sure it's happening at more places than what we have seen. But as I said, we are speaking only about exactly what we have seen. And to be honest, that is extremely concerning and very unethical of the healthcare workers and the security involved. So we are very worried about that. We have flagged it to the Department of Health, and we have named the facilities to them that we witnessed this at and asked them to address it immediately.
What is important, Claire, as well, exactly what you have just highlighted now, that members of staff could possibly be colluding with members of Operation Dudula. That picture, what does it tell you about the levels of frustration at community level? Because these members of Operation Dudula are saying it is as a result of government's failure to enforce immigration laws that is forcing them to, as they put it, to do the work that government is supposed to be doing. Do you, or should society have sympathy for people doing this, given what they highlight as a government failure to do what they are supposed to? Because I'll tell you why I'm asking you this question in this way. It is that oftentimes you'll be told that it is not in the suburban areas where people will go to the nearest healthcare facility where they will pay for services, but this, or people are taking matters into their own hands in township areas because healthcare there is free of charge, but what they are experiencing is that South Africans are being overlooked or they are treated less than, whereas they're supposed to be, I suppose, they're supposed to get priority over people who come from different countries.
Yeah, thanks. I think that's a really good question. And it is really important to acknowledge the complexity of this situation because South Africans have every right, as you said, to be frustrated about the state of their healthcare system. And I, as a South African, am also finding that very frustrating. It is true that there are real structural and systemic issues within our health system, and communities are right to stand up about that and to demand better service and to demand that their needs are met. However, where things are going a bit off course here is by blaming people who really have nothing to do with that. The thing here, I think that we need to be honest about is that there are significantly more issues in our health system that are not caused by migrants or even people, any people accessing the healthcare. It is caused by other issues within the Department of Health, a mismanagement of resources, other systemic issues that have been around for a long time and need to be properly addressed. I completely support communities in their frustration, but what we're doing here is blaming the wrong people, and that is a problem. People seem to have this idea that there are just millions and millions and millions of migrants accessing healthcare in South Africa, and it's not true, despite what all misinformation, let me say, would have you believe. Migrants make up a very small part of our population. Let's say it's between 4 and 7% at the moment. Of those, many do not use public health care. The ones who do use public health care are the ones who don't have another choice. And often what we find is something that we call loosely the healthy migrant effect, which is that migrants do tend to be more healthy because they are migrants, because they have had to travel a long distance or because they are not at home and they are nervous about going to healthcare for exactly these reasons. So the burden of migrants on the health system is vastly overstated. That said, I completely understand why South Africans are frustrated, and I really support communities in standing up against structural health system failures, but I do think we need to be targeting the right people for that.
Interesting that your statement is calling for the intervention of government, in particular the Department of Health. I had the privilege of talking to the health minister and put this question directly to him. And the question was phrased in this way, that for the longest time, there has been this mooted discussion with neighboring countries whose nationals come to South Africa for healthcare to say, subsidize, at least pay us a portion of the amounts that we use to treat your citizens. And Minister Motsoale's response was that, well, we get told in the case of Zimbabwe, for example, that we do not send undocumented people to your country, and therefore it cannot be our responsibility. When you hear a response like that, do you think it's going to harden attitudes of South Africans in particular?
It may well do. I think that there is a lot of misinformation, a lot of very hard stances on this being taken, because I think this debate has become very political now, which, I suppose is natural to an extent. But I think what people are forgetting is that there are real human beings at the bottom of this debate, and there are real human beings being impacted every day. And I struggle to believe that the average South African would turn away from a pregnant woman in labor and say, you have to give birth on the street, or from a 6-month-old baby, which is a case that we have witnessed witnessed with our own eyes a 6-month-old baby with breathing and respiratory issues being turned away from a clinic. These people are not to blame for the problems that we have in our health system, and they are humans who are scared, who are worried, who can't turn elsewhere, and they need our support, and our Constitution guarantees it, and our Constitution upholds all of our rights for all of us in South Africa. And if we start to question one right, who's to say what rights will be questioned next?
Yeah. Finally, Claire, let's talk about what you would like to see when you are calling for government intervention, because Dudulla will tell you, as we have said right at the start of this conversation, that we are doing the government work here. We're doing what government is failing at doing. And so what would you like to see as Doctors Without Borders?
I would point out that I absolutely do not think it is government work to be turning people away from health facilities. But I can take the point that what they believe they are doing is underburdening or taking away some of the burden on healthcare facilities. What I would like to see, or what MSF would like to see in particular, is for government to say that that's not acceptable and that they need to be the ones dealing with this. And I would really, as MSF, like to see them engaging with communities on this, understanding their frustrations and working with them to see what they can do better to serve communities in the health system, because clearly there is a lot of frustration. So I would really, as MSF, we would really like to see government fully condemning what is happening, making sure that health facilities are safe for anyone who needs to access them, and then working with communities, both South African and non-South African, to explain people's rights, to work on the structural issues that are happening, and to reassure non-South Africans that they can access health facilities and that it's in everyone's interest if they do. This is where I think we are being a little bit short-sighted here as South Africans by supporting this. Is public health is exactly that. It is public. It impacts all of us. When some of us are ill, more people get ill. It is not going to work in anyone's favor if suddenly we have a whole load of HIV patients who are defaulting from their medication because they haven't been able to access it. If suddenly we have children who are desperately ill who cannot access healthcare, if we have other chronic disease sufferers who cannot access healthcare, it will hurt all of us in the end. And as I said, South Africans are being hurt by this at the moment because they are also being turned away in these instances, as are very well documented foreigners. So we need the government, and particularly the National Department of Health and the provincial departments of health, to be strong on this issue, but also to understand why there is frustration and speak to the people involved. And I don't mean the anti-migrant groups, I mean the average community members on the ground, to understand what they need and to work on that with them.
Claire Waterhouse, let me thank you very much for your time, a representative of Doctors Without Borders. Thank you indeed. And this particular conversation is really an emotive subject. As we are talking, Claire and I, someone sending me a tweet saying that they would have liked to see members of Operation Dudula also represented in this discussion. Well, the response to that is that a member of this newsroom was out on the streets, Veronica Makwadi. She actually did speak to members of Operation Dudula, especially on some of the matters that Claire has highlighted there. The fact that there are not only just undocumented migrants that are being blocked, but it's people even with papers, including South Africans who may have forgotten their ID at home. And I can tell you what the response was to that question, that are you not afraid that you are also blocking even South Africans who may not necessarily look South African in your eyes? And there was a complete denial that that did happen. So just some of what you are asking for, and hopefully we can bring you clips of that in the later bulletin.